Hello, this is Maybe I'm Rambling, and now we can talk about something cool. Biden names HIV researcher to lead CDC. For those of you who don't know what that is, that's the Center for Disease Control. The president-elect Joe Biden has moved Joe Blow to fill two top health positions in his administration. His transition team announced today California Attorney General Xavier Becerra will be nominated as a Secretary of Health and Human Services. And HIV/AIDS researcher Rochelle Walensky of Harvard Medical School and Massachusetts General Hospital has been selected to direct the Centers for Disease Control and Prevention (CDC). Biden's choice of Walensky has drawn widespread praise from infectious disease and public health experts who say her experience as a physician and AIDS researcher and her communication skills will serve her well as director of the country's premier public health agency. During the COVID-19 pandemic, she's an outstanding choice. It's a bright future for the CDC, says James Curran, Dean of the Rollins School of Public Health at Emory University, a former director of CDC's HIV/AIDS division. Walensky shares her reaction to the nod on Twitter. I began my medical career at the height of the HIV/AIDS crisis, and I've spent my life ever since working to research, treat, and combat infectious diseases. I'm honored to be called the lead brilliant team at the CDC. We are ready to combat this virus with science and facts. Becker is an attorney with no health background. He served on the House of Representatives committee that oversaw the Medicare and Medicaid programs as a 12th term member of Congress. As California Attorney General, Becerra had led efforts with other states to defend the Affordable Care Act and women's reproductive rights. As a physician and epidemiologist, Walensky is a conventional choice for the CDC director. Her specialty is AIDS research, including promoting HIV testing, developing the treatments in South Africa, and leave them alone, bro, and modeling the cost effectiveness of giving groups vulnerable to HIV drugs to prevent infections. In the past year, she has advocated strong action to control the spread of the coronavirus, as well as large-scale viral surveillance using rapid tests of universities and elsewhere. She's somebody who is an incredible leader in infectious diseases globally and particularly in HIV, as well as a clear communicator on COVID-19, says Jen Cates, a senior vice president and director of global health and HIV policy at Henry J. Kaiser Family Foundation. All those qualities are really important. I was surprised but elated because you couldn't do any better. But it's not just because I know her, says Yale University public health epidemiologist Greg Gonzalez, who in October co-authored an opinion piece with Walensky criticizing President Donald Trump's views on herd immunity's roles in managing the pandemic. Under Director Robert Redfield, the CDC has struggled to issue clear public health messages about COVID-19 amid pressure from White House to downplay the pandemic's impact. Walensky will need to help oversee an unprecedented vaccination campaign and beyond the pandemic. She'll face enormous challenges in upgrading the scientific capabilities and credibility of the CDC, says Barry Bloom, a researcher and former dean of the Harvard T.H. Chan School of Public Health. I have no doubt she'll provide leadership required, he adds. Biden's announcement today formalized previously disclosed appointments, including his intention to make National Institute of Allergy and Infectious Diseases Director Anthony Fauci his chief medical advisor on COVID-19, and to appoint physician Vivek Murthy, U.S. Surgeon General during the Obama administration, returned to that post. The HHS and Surgeon General positions require Senate confirmation. Well, as you can probably see, we want to more or less have a head start, because for now we got some who's appointed to do something reasonable. It's about time someone tackled HIV and AIDS, because those have been killing people. If anything, they should start researching those crocodiles, because the crocodiles, they're eating so many people who have AIDS that they actually become resistant to it. So if anything, they should check out the immune systems of the crocodiles. Maybe to crack the code on how they were able to acquire a reasonable resistance to HIV. But who knows? I also think that they're never going to cure it. They keep saying that and they never do it. But hey, that is me. Maybe I'm rambling.